28 to 32, depending if you have your wisdom teeth or not. And each tooth has an all individual space, nerve, bone. So there are organs in the body and they have to be considered individually. So you have to take care of each one of them. So if I have to pick the bare minimal, which is maybe brush once a day, make it in the evening. Some people think it's in the morning. No, in the evening.
So welcome to Aykafa, Soberhead. Today's topic is oral health. I have a guest today from London. She's originally from Spain. Lately, I listened to this oral health podcast that Andrew Huberman did, and I learned so many things that I had no idea. I mean, I'm ashamed of myself in a way, because I think that if you're not American born, they don't teach you these things when you're a little kid, at least on my time. Maybe now they are. Since I know Sandra, and I will ask her to give me a little background about herself, but knowing that she is very well knowledgeable about longevity biohacking in the oral health arena, and she's a philanthropist, which I love because people who knows me knows that, I do work in that philanthropy field as well. With that said, welcome, Sandra. I would love you to introduce yourself because probably dentistry is one of the fields that I really do not know what are the steps ones go through to become a dentist.
Well, thank you so much for having me in your podcast today. My name is Sandra, like you said, and I'm originally from Spain, but I've been living and practicing dentistry in London for the past 15, 16 years. I studied in Barcelona dentistry, and then I moved to New York to do my postgrad, my specialty, which is basically in dental aesthetics. So that's what I work off now here in London.
Wonderful. Also, I can say that she's a celebrity dentist, which is a good thing, because when people deal with high-profile individuals, you have to be much more precise with your work. There's a really small amount of mistakes one can do. So it's always a good thing to have as a guest because I know that they take what they do so seriously because of the low amount of mistakes that they can do. So Sandra, what is oral health? Because before these all podcasts, when I would hear like oral health, right away I would think of the teeth. I wouldn't think the whole mouth. Since I listened to the podcasts last couple of weeks about oral health, I started reading some papers, looking into different presentations of different doctors. And I realized that, oh, wow, oral health doesn't mean just teeth. So I would like to hear your take. What is oral health?
For me, oral health is the well-being of the mouth. And the mouth obviously has teeth, has a tongue, has soft tissues, cheeks, gums. So it's everything. The body starts by the mouth. So it's the entrance to the body. And the well-being of that will be connected to the well-being of the body itself.
I see. Then in a perfect world, please give me the daily routine. What should be the perfect daily routine for one to be taking great care of their mouth?
Well, it all starts with what you put inside, right? So from what you drink, what you eat. So the well-being starts with that. And then obviously taking care of it by keeping it clean. So in an ideal world, you would brush your teeth 3 times a day or every time after every meal, main meal, and floss. For me, flossing is as important as brushing. And then in an ideal world, you rinse as well, especially in the evenings, which is the most important of all. That would be the ideal patient for me. Definitely to have low sugar intake in the diet and low carb intake of certain carbs. Obviously, some carbs are good. So the difficulty is diet, I think, when it comes to oral health more than anything else. Yeah.
So now that you jumped into the diet, can you please explain me a little bit what happens if one eats certain type of carbs or sugar or similar acidy foods?
Basically, what happens is the strongest structure we have in our body, stronger than anything else, is the enamel of the teeth. But acids and sugar attacks that strength of the enamel and it makes it weak. So when it makes it weak, it removes the minerals that it has. If you expose that acid or that sugar for X amount of time, you can get a cavity from these things. So it's very important that when you eat something naughty, if you want to call it that way, you definitely brush your teeth after, because those acids attack very fast. So it's all about, when you eat the acid, that there's an acid spike, try to neutralize it as fast as you can.
So basically, we're not saying do not eat it, but if you're going to eat it right after, it's best to take care of your teeth so that it wouldn't leave a residue and then it would create a cavity in the long run.
Exactly, yes. Myself, for example, I love chocolate. I love dark chocolate, which in the range of chocolate probably is the best one, but I wouldn't stop eating it, or people that like their red wine, which is pretty acid as well. You at the end of the day, we live once, but you can minimize those things. I don't say that, you have to stop eating or drinking certain things. It's just be aware of what they can do in your mouth and just try to, keep it clean.
I'm going to ask you the next question. It's going to be sounding a little weird, but what is the least minimum one can do? Because, I'm from Turkey, and in certain parts of the world, it's parallel to the education level or the school systems, let's say, not education level of families, but the school system. It may not be a priority to teach these to kids. So what is the least minimum one can do to at least have a healthier mouth? That I know that would be a challenging question to a
very challenging, but I'm just going around like, what can I negotiate? But if you tell me, for example, you have to pick once a day to brush your teeth, I would always say the minimum, always at night. Because when you sleep, you don't generate saliva, and the saliva protects that oral cavity. So therefore, when you're sleeping is not as protected. So if I have to pick the bare minimal, which is maybe brush once a day, make it in the evening. Some people think it's in the morning. No, in the evening. Because obviously during the day, you talk and you generate saliva. Therefore, everything's more protected. So that would be the minimum of everything, yes.
All right. That's information to people if they choose to do this once, which we suggest not to. But if
Never.
they do, then pick the evening.
The evening, yes.
Then let me get deeper into this. So you brush your teeth at night. Then after, if you're a smoker, you smoke a cigarette or two, whatever, up until your bedtime. Do you need to brush again, or rinsing your mouth would be enough?
Yeah, if it's tobacco, probably rinsing your mouth would be enough. But tobacco creates different issues in the oral cavity, not just the teeth, the staining, the color, that it's obvious what it does. But in the teeth, it constrains the oxygen from the tissues, from the gums. So, and it dries everything, right? So a good thing would be to rinse if you don't want to brush again, for the flavor, to definitely rinse. Yeah, it would help.
In one TED talk that I was listening to, this American doctor, he was saying in order to have a good oral hygiene, it takes a good 5 to 10 minutes taking care of your mouth, the maintenance. How do you add up these minutes? Because I tried to count the minutes last night. I was just like,
it's not working.
This is 2 minutes, and then this is 1 minute. I need another 2 minutes to do some things.
So if you think about it, you should brush 2.5 minutes, right? The mouth normally, when you start, you divide it. You have 2 arches, one at the top, one at the bottom, and 3 main surfaces, right? The outside, the inside, and the top. So you normally divide the mouth by 4, and you start brushing, then the inside, then the occlusal, which is where you chew, and then you repeat. So 2.5 minutes to 3 minutes of brushing. But then you floss, and you floss every single surface in between the teeth, right? So that's 32 to 28 teeth on average, if you have your wisdom teeth or you don't, to get through. And then at the end of everything, the mouthwash to rinse for an extra 30 seconds. So probably that's more or less the time.
And there's the tongue.
And there's the tongue as well, obviously. So then the tongue is fast. The tongue shouldn't take more than 10 seconds. But yes, as well. So probably on average, yes. And if you're with your phone while you're brushing your teeth, then you can add as many minutes as you want.
Of course, you're right. Then let me ask you about the products, because there's a huge debate, as far as I know, in America, that in California, the fluoride, it's like everybody's against, and especially because they also add it in the waters. And on the East Coast, now parents are suing states that you didn't add enough, or you should add fluoride to the water because of the strength of the kids' teeth. But in the longevity arena, we started learning that fluoride causes so many issues, from pituitary gland function to maybe different type of chemical interactions. What is the right products to use?
It's very difficult. Like, one person will say one product, one person will say. I think it's a personal thing when it comes to fluoride. I would recommend it definitely in kids, but adults, I wouldn't recommend fluoride, because you already have it, like you say. You have it in water, you have it in many other things. So, and it does block the pituitary gland. So I wouldn't recommend extra fluoride myself in toothpaste. Definitely not. But to kids, yes. Because, as you know as well, kids are not the best at following instructions when it comes to brushing the teeth. It's one of those things that they rush into. So at least what they get from the toothpaste, they get more protected, because there's no way you're going to get a kid for 2.5 minutes to be brushing their teeth until they become aware of what it means to brush their teeth. Definitely, I would recommend fluoride in their toothpaste, or even fluoride tablets as well.
Maybe we need to explain to my audience a little bit more what fluoride does.
It protects the enamel. It strengthens it from not being as susceptible to receive acids and to create cavities. And that's what it does. But an extra fluoride, if you add too much, it's not good for other functions in the body. It will still be good for the mouth, but not for the rest of the body.
What do you recommend then if the person is not going to use a toothpaste with fluoride inside, but they still want to kind of give some support to their enamel? What would be the closest product that one can use?
I wouldn't recommend any product. I would recommend just a healthy diet. I wouldn't recommend any product for extra fluoride. No. I mean, sometimes what you can do if a person has weaker enamel, sometimes what I do with some patients, there is toothpaste that we prescribe, and to do it out of the year, to maybe do it for 1 month, that would give them enough strength, and it wouldn't cause any damage in the body, to be exposed just for 1 month a year. It's okay. And it does work in strengthening enamel. But that is very few cases that I would recommend that.
Lately, I started seeing on toothpaste the xylitol, and I actually asked you about it the other day when we were chatting. I heard on Huberman, I didn't even know the name of it. It took me a while to memorize the name. And from my lovely producer, Arkan, I just heard that they're also in gums, which I don't chew gums, so I wouldn't know. What is that chemical for?
It's a healthy sugar, if you want to call it that way. It doesn't affect, it actually helps prevent cavities, and it's used in many healthy desserts, in chewing gums, and it neutralizes the pH of the mouth. So it's very good. It's a very good alternative to sugar, much better than any out there.
But also it kind of supports the teeth.
Yes, so that's why it protects from potential cavities.
Yeah, I mean, these are all such detailed information that I also spoke with you. I said, how do you guys teach these to your patients? And you say, like, our technician.
The hygienist.
Yeah.
Things like xylitol that you were saying, right? It's sugar alcohol found that you get from plants. Obviously, the hygienist is not going to tell you. When it's a person that I see that has a lot of cavities, and I know there's a high influence in their diet to the way their mouth is, I normally go through, okay, what is it that you eat? And if they have a sweet tooth, I always recommend alternatives, because, for example, something like xylitol, you can buy it like sugar. You have to use probably double to get the same effect than natural sugar. So then it's healthy. There are alternatives. But obviously it depends. how much you interact with your patients, how you train your hygienist. If it's a new patient, when they come to see the hygienist, I always say, please bring your toothbrush so that they show you how to use it properly. Because even myself, I wasn't taught how to use the toothbrush, right? Until I started going to a dentist. And I think that's very important. We're just not taught these things.
Nobody told me that flossing is as important, cleaning the tongue. In time you learn these things, but what you learn is bits and pieces, not the correct information, such as, since I am very much involved with this biohacking world, and longevity, the third thing that I learned, one is, I didn't even know, the metal in your mouth, fillings,
Amalgam,
or
mercury fillings,
mercury fillings, or anything that you have any metal, it would be attracting all the EMF radiation. It's like a antenna, radio antenna, they say.
It is metal in your mouth. So if you just leave it in the mouth, it doesn't really cause any damage. But the moment there's friction, as in chewing, you're obviously releasing those particles, and those particles that go to the saliva and they go inside your body. So they cause inflammation in the organs and toxicity. Very small percentage, but if you do that every day, many times a day, which is every time we chew, it's a lot. So these are small things. It's like having your phone all day long with you, right? The radiation that the phone, there's so many added things, but obviously if you have a choice, definitely you wouldn't have anything in your body that is not biocompatible, that is not healthy. I wouldn't. And definitely metal wouldn't be one of the materials I would choose to have.
What you're saying is the heavy metal mixing with your bloodstream in a way.
Exactly. And it's proven to cause inflammation in the body. It's not something I'm making up. There are enough scientific articles out there that show the link for depression, that show the link for many different things. Well, infections in the mouth, metals in the mouth. Can
you please explain a little bit, what is this oral microbiome? How does it get disturbed? Also, if you do not have a healthy mouth, what happens? Because there's so many other secondary illnesses that is going to be causing. What is the pathways? How does it happen? If you have an inflammation in your mouth, what's going to be the next thing that one can be facing with?
It's basically an ecosystem, right? So you need to balance it, and you need to keep it as clean as possible. So if the entrance to the body is not clean, it's like when we talked, I told you, it's like having the house clean, but behind the furniture full of dust, right? So it's still going to affect the whole air of a space if it's not entirely clean. It's crucial for health, and it can directly cause problems in the mouth and in the system itself. How to keep it in a good state is always by keeping it clean, by brushing, by flossing in terms of the oral cavity. We've seen that many gum problems, for example, directly linked with diabetes, with heart conditions, other systemic conditions, tumors. It's very scary what an infection in the mouth can do. And when it comes to the oral microbiome, it's not just teeth. Teeth are, you have from 28 to 32, depending if you have your wisdom teeth or not. And each tooth has an all individual space, nerve, bone. So they're organs in the body, and they have to be considered individually. So you have to take care of each one of them.
What would be the pathway though? Let's get a little bit more in detail with, if you have a gum disease, what's the pathway that may be causing, let's say, cognitive problems or heart problems?
It's an imbalance, right? So you need to maintain a state of equilibrium so that the pathogens, the bad things, don't manifest. So for example, if you have gum disease, the gum is what surrounds teeth, but all those vessels are connected everywhere. In your head, in your eyes, in your ears, nose, everything is connected through the bloodstream. If you have an inflammation in the mouth, it will continue everywhere else. So the first thing, normally, diabetes, obviously, because it's blood and it's sugar, but then heart conditions are very, very related with canines, which are the longest teeth in the mouth. because of where the nerve of the canine travels to is very connected to the heart, as they have the longest roots. It's very difficult to explain, but if you had an open wound anywhere else, you would pay attention to it, to heal it, because it can cause infection in the rest of the body. So the mouth is exactly the same. By having gum disease, bleeding gums, or an infection in a tooth, that would cause the rest of the body, because everything's connected. It's not isolated. Everything's connected internally. So obviously you have to pay attention individually so that it doesn't spread generically.
It's sometimes hard for people, even me probably, that, when you don't see it, when you don't have a pain, it's really difficult to understand that, or little bleeding when you're flossing. If there's a little bleeding, you don't pay attention. But what you're explaining is that it's almost like you have a cut on your hand and you wouldn't let it open and let all the germs and everything else climbing to your skin, and then God knows where they go. So that's what you're trying to explain.
Exactly. If you were bleeding anywhere else in your body, you would pay attention to. So the mouth, hopefully you would pay attention to instantly, right? The instant as a human being, if there's a cut, is to put pressure and stop the cut, right? So in the mouth, it surprises me how many people, but again, it goes back to lack of awareness. If your eyes don't see, your mind or your brain doesn't know. So if you don't know that bleeding in the mouth can cause many other issues, or it's bad for you, why would you pay attention to it, right? Many times it comes from lack of information. So normally the most common thing when it comes to bleeding gums is from patients that don't brush as well, they don't clean as well their teeth. So the plaque from foods, from having a dirty mouth, accumulates, and it normally accumulates like something soft, but if it's not removed, then as the time goes by, that soft piece of bread, for example, that you leave there becomes hard like a stone, and it gets stuck under the gum. And it's like me doing like this hard into my hand for 24 hours. After 24 hours or even 12, I'll get a bruise, right? So if you think of it in the mouth, when you're pinching that gum, the gum reacts by bleeding. That's why it bleeds, because there's something there irritating it.
That's really important. Totally a new topic now. I also heard that at the conference that I was at, A4M conference, and I shared this in my previous podcast. I was a big Listerine user, and I don't mind sharing a brand name. Up until I heard, any alcohol-driven mouthwash would be affecting the nitric oxide pathways in your mouth, and if you damage them or stop the production, let's say, then anywhere in your system also the nitric oxide production would be reduced. And I'm like, okay, now I'm not using that. Just like I was asking around, like, what am I going to use? And including you said use coconut oil.
Yes, or salt water, for example.
So tell me why alcohol-based mouthwash are not good for us.
More than 25% of alcohol is definitely not good for you, because basically what it does, it's a drying agent. So it inhibits the production of saliva. Like I said previously, what you want is to keep the mouth protected, as much protected as possible. So the mouthwash normally is done after brushing your teeth, and at night especially, that is when the majority of people spend more time, because they're home, they're not rushing to go to work, or after lunch, that, rushing to get back to work. So if you use one with alcohol and it dries the mouth and it affects the production of saliva, what you're doing is the opposite. You're not protecting the oral cavity as much when they have alcohol. Normally more than, around 25%, that it's not recommended.
Why coconut oil? That's a personal question. Because I started using it, but I don't know why is it good.
It neutralizes any acid, and it's a very good antibacterial.
Oh, really?
Yes, by leaving it in the mouth for, 30 seconds. Some people say a couple of minutes. I struggle to leave it in my mouth for a couple of minutes because it is oil and, it gets like a bit too much. But it is an antibacterial, so it helps to remove inflammation from the gums. It helps to protect the teeth. It's very, very good. It's very good. They do it in India all the time. And I can tell you where I've seen it is in areas where people don't have access to brushing their teeth as much. And it's incredible how they might not have one cavity, even though, for example, countries like India or like China, the daily intake of carbohydrates, because they use a lot of rice, is very high. Therefore, they should be more prone to cavities, and they don't have as many.
That's really interesting.
The technique is called pulling oil.
Yeah, I started using that, and I was just like, I'm going to wait for this recording to ask her why coconut oil. I'm using it. I have no idea. Why is it good? Another weird, so I love this episode. It's like a question and answer. Mostly what happens with my guests is like I ask a question and by the time I ask the second one, it takes 10 minutes. This is nice. I have a bunch of questions that I can ask and have a short answer and continue. I heard also this weird description, what not to do. I would love to hear why not. What they say, let's say you're rinsing your mouth with water or with oil. Do not swallow it.
Yes.
It's why.
If you think about it, you're trying to clean a surface by putting something in. You're not going to swallow the dirt that you've just removed. You spit it out. So it's like, for example, washing a dish with soap and not rinsing it.
So what you're saying, all the bacteria
all the bacteria
whatnot
is going in your body. So yes, it's not a good idea.
Okay, let's get a little weirder. What I heard, and I sent it to you the other day, they were talking about first thing in the morning when you wake up, take a little sip of water, wash your mouth with it, and swallow it so that your oral microbiome would mix with your gut microbiome.
I don't have evidence from this, so I'll
You pass.
pass the question.
but, no, but I mean, that was interesting. So supposedly it mixes up that you kind of carry the good bacteria to your gut. That's really weird and disgusting, actually. But, I thought I would ask.
There are more disgusting things. Yes, I'm not going to get into.
Okay, then. Let me ask you then, what type of brush is the best brush?
It depends. It depends because you have gums. Gums are skin, but in the mouth, right? So you have gum that is very thin, the same as you have, very white skin, very dark skin, brown skin, all kinds of skin. Thickness of skin is also different in each human being. So the gums are a little bit the same. If you have very thin biotype of gum and you use a very hard brush, instead of helping that gum, what you're doing is stressing that gum. So the gum recedes, meaning it disappears, right? If you have very thick gum, that gum can support hard brushes. Therefore, there's no influence in what kind of toothbrush, the head of the toothbrush. I mean the threads, right? The little hairs. So it depends. It depends. From one person to another, it varies. So on average, a medium force is fine, but it really depends. There's no right answer.
So we're going to be focusing more on the gum than the tooth itself.
Yes.
You're talking about the gum would be.
Yes.
I see. For the tongue, scraping or brushing?
Scraping, unless you have a toothbrush that you only use for the tongue.
Okay. Why scraping?
I find you remove much more that you remove with a toothbrush because you're actually scraping a layer.
I see there are some tongue paste. Necessary, not necessary?
Not necessary. At the end of the day, it's like everything. You can end up buying 1,000 gadgets, but which ones really work, which ones you really need, I wouldn't invest in that.
Okay, next question would be, how often you need to change your toothbrush?
I would say when you see the threads are open, start to be a little bit open, on average, every 3 months. It depends. If you're one of these people that really brushes really vigorously and really hard, then probably the heads would last less.
Then how do you protect the toothbrush when it's wet? Do you just leave it open air? You need to cover it? Is there a better way?
I always dry it first in a towel or with tissue, with the like absorbent tissue. I dry it. So, and I cover it, but not cover it full, just cover the top part so that nothing from the air goes into it. But it still has a way of an oxygen way of liberating whatever's left of the moist.
So we said that do not use the same brush because it was a fast pass over there. So we're suggesting people, if you're not scraping but using a brush, do not use the same brush that you're brushing your teeth. Why is that?
Exactly. Because it's different kind of things that you're removing. And I personally just stick to the tongue is a complete different surface from the teeth. So I would keep it separate. It's the same as when you floss and people say you can't use the same piece of floss for every tooth. And I said, no, because you're spreading bacteria from one place to the other. So you clean it with a clean surface and you get a new piece of floss.
Okay, that was a new information.
So when you floss, you get a long piece. You wrap it around and then you start with one tooth and remove that piece and get a new piece. So that's why you get a long piece.
Okay, when you buy these the sticks, it's just not really clear.
Between each one, you have to clean it, wash it.
Okay.
You know, so that you're not removing bacteria from one place and adding it to another one.
With all these, we added up to 10 minutes already. The cleaning thing, like the thread, you wrap. That's a very fun.
An hour a day keeps the dentist away. Yes.
I'm laughing a lot. So, Sandra, tell me a little bit about your work overseas with
Eleuthera.
Yeah, yes. Eleuthera. Okay.
It's a foundation that Dr. Jonathan Levin started. He's my mentor. And we go to an area in an island in Bahamas, which might sound very exotic. Definitely it did when I first heard about it. And I thought it was a joke to go and do charity to paradise. But like every single paradise, there's lack of certain things. In this case, it's lack of dental care because there's not one dentist in this island or in the neighboring islands. We started going there to a small community that now is very big because now we nurture other islands that are around. What we have created, it's already December, it was the 7th mission. What we have created is a change in people's lives, basically, or their oral care has completely changed. We go there, we extract teeth that are rotten, we show them how to brush their teeth, we take a group of hygienists, we do fillings, we do dentures. We haven't started with implants yet because, like everything, it takes time. The logistics, the facilities, the evolution of the project has been unbelievable. The reason that you were asking me why we went to Eleuthera is because one of our partners is Lenny Kravitz, the singer. It's his community. It was his idea to go down there. He wanted to help his people, and that's why we started there. It's the highlight of my year to go there every year because, like I was saying, you see a change in a community. You see how a person that has no teeth and all of a sudden they have a smile. It's such a powerful thing, be able to give happiness through a smile. Basic things that we take for granted in this side of the world and that they're so important. So I'm very happy to be able to help.
That's really, really, really important. People who knows me knows that I'm doing similar works in the addiction field. Last but not least, I'm going to be seeing you in London, but tell me, you came to Turkey before, yeah? You know a couple of people from here.
Yes. So I have good friends in Turkey. I've been there before with Dr. Galip Gurel, that he's unbelievable. And he does the same kind of work that I do here in London. And I love Istanbul. I've been, I think, like 5 times. Yes. So that's how much I love it. Great place with great professionals, great dentists. I know surgeons as well. On this side of the world, Turkey is known for their hair transplant. So, but I think it's a beautiful country with a lot of potential, especially Istanbul, which is one of those places which the first time I went, I had no expectations because I didn't know what to expect, and it blew my mind from a cultural point of view in all aspects. So yeah, you're very lucky to live there, definitely.
Thank you. Thank you. Yeah, I love my country and I'm trying to serve as much as I can. Thank you very much, Sandra. I know that I
You're
questioned
welcome.
you in a way, quick, sometimes very in depth questions, but thank you for giving us your time.
My pleasure.
I'll see you soon.
Definitely. Thank you so much. Thank you for having me.